Namaste. Welcome you all for the yoga session. In this session, we are going to use a couple of blankets and a chair. We are going to do some side bridges and also downward facing bridges for the stability and strength of the trunk, especially the lower back. Before that, we shall do some preliminary postures for the core muscles. Lay on your back, resting the legs on the seat of the chair. Keep an appropriate blanket below the neck. Ensure that the complete spinal muscles are properly rested on the mat. Keep both the palm on the abdominal cavity. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. While you exhale, contract the abdominal muscles little more than normal and specially sensitize even the posterior region, that is the region of the lower back and the fascia, the thoracolumbar fascia at the back, that should also respond to the breathing. Be watchful. Good breathing is very essential in all the postures. This breathing should be maintained in all other movements that you are going to practice. A good abdominal breathing also helps the mind to relax. Rise your right leg up. Stretch the heel, pull the kneecap, tighten the quadriceps, the top of the thigh. Pull the kneecap, feel the hamstrings, back of the right thigh. This is a good stretch. Simple but very effective stretch for the back of the thigh, the hamstring muscles. You have to stretch the toes towards the knee. Stretch the calf muscle. Now flex the knee. Keep the right leg down. Chain, left leg up. Pull the kneecap. Stretch the heel. Tighten the top of the thigh, the quadriceps. On pulling the kneecap. Left leg down. One more time. Right leg up. Pull the kneecap. Stretch the heel. Keep the right leg absolutely straight. Toes towards the knee. That will help the Achilles tendons to stretch, which will reinforce the stretch of the calf muscle, and this in turn intensifies the stretch at the hamstrings. Right leg down, chain, left leg. The tone of the hamstring muscles is very important even for the back to be healthy. So this movement also helps the hips and the lower back. And all this breathing is very attentively be done. left leg down. Relax your breathing, watch your back, rise your right leg up, fold, hold the knee, press the knee closer to the chest. Stretch the toes towards the knee. And activate the right hamstring muscles. That is, press them against the calf muscle by tightening the hamstrings so that you can feel the knee capsule. And draw the knee inline and closer to the chest. Release right leg, chain, left leg up, fold, hold the knee, press the knee closer to the chest. Activate the left hamstring muscles so that you can feel the knee capsule. And breathe properly. As you inhale, the abdominal cavity expands. As you exhale, it contracts. This is a good movement for the gluteal minimus and medius, and also helps the lower back muscles. Release left leg. One more time, right leg up, fold, hold the knee, press the knee closer to the chest. From the hands you should pull it closer to the chest, but ensure that the hip, knee and ankle, they are all in the same plane. Release the right leg, chain, left leg up, fold, hold the knee, pull the knee closer to the chest. Breathe properly. Make the exhalation a little slower than the inhalation. Make the exhalation more profound by contracting the abdominal muscles little more than normal. Release left leg. Right leg up. Fold from left hand, hold the ankle joint, pull it closer to the root of the left thigh and push the right knee. Take the heel as close to the root of the left thigh as possible and watch your breathing. As we inhale, try to feel the base of the spine, and as I exhale, contract the abdominal region. Release right leg, chain, left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh. From left hand, push the left knee towards the chair. This is a good movement for the base of the spine, especially the sacroiliac joint. That is the joint where the hip and the spinal column meet. Even in this, tighten the hamstring muscles back of the thigh so that you can feel the knee capsule. Release left leg. One more time, right leg up, fold from left hand, hold the ankle joint, pull it as close to the root of the thigh as possible. Then push the right knee. So these simple movements give a good tone for the core muscles, especially in the lumbar, pelvis and hip complex. So these are some very safe starters for any other movements to follow. Release right leg, chain, left leg. Left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh and push the left knee towards the chair. Breathe consciously. Breathing is the key for the success of any posture. Get connected with the breath. Get connected with the posture. Release left leg. Watch the complete paraspinal muscles. Right leg up, fold from left hand, hold the ankle joint, pull from right hand, push the knee across the chest. You have to pull powerfully and then push across the chest. Feel the stretch in the gluteal region, especially the gluteal maximus muscle gets a good stretch in this posture. Breathe well. Be aware of your breath. Release right leg, chain. Left leg up, fold from right hand, hold the ankle joint, pull from left hand, push the knee across the chest. The gluteal maximus muscle is one of the major muscles of our body, so this posture gives a good and intense stretch for the gluteal maximus muscles. You have to push the knee across the chest so that you get a more penetrating stretch. Release left leg. One more time. Right leg up, fold from left hand, hold the ankle joint, pull from right hand, push the knee across the chest. Feel the complete hip musculature. Feel the muscles of the lower back. To feel the muscles of the lower back or the posterior surface, you should use your breathing to sensitize that region. Release right leg, left leg. Left leg up, fold from right hand, hold the ankle joint, pull from left hand, push the knee across the chest. So this posture is also one of the very important postures for the health of the back. Release left leg. Breathing relaxed. So this in some sense is a series of postures that would help the core muscles in a gentle way, and they prepare these core muscles for further action. Slowly get up from the right side. Sit upright. Chest and navel up. Put a blanket on the lower rib of the chair. Lie down sideways, right elbow on the blanket. Rest both the legs on the lower rib of the chair. Top leg forward. Inner exhale, rise. Left hand on the waistline. Turn the neck, look up. Breathe well. As you inhale, abdominal cavity should expand. As you exhale, it should contract. Do not push the hips back. Push it front. Be stable. Be aware of the complete trunk muscles. Be aware of your breathing. Slowly come down. Chain. Left elbow on the mat. Press the forearm. Take both legs on the lower rib. Right leg forward, left leg back. Inhale, exhale, rise. Right hand on the waistline. Chest up. Turn the neck, look up. Watch your breathing. Be stable. This is the so-called side bridge. Two supports. One at the foot, another at the elbow. Slowly come down. One more time. Right elbow, forearm pressed on the mat. Both legs on the lower rib. Inhale, exhale, rise. Left hand on the waistline. Rise the hips. Turn the neck, look up. Both legs straight. Watch the paraspinal muscles. Watch your breathing. Slowly descend. Change side. So you have to hold the trunk stable against the gravity. So that's where a lot of the trunk muscles gear up into action. Left forearm on the blanket. Both legs on the lower rib. Right hand on the waistline. Inhale, exhale, rise. Look up. Try to keep the hips and trunk in the same plane. And watch your breathing. Watch the position of the shoulders and the hips. Slowly come down. Sit upright. Now keep the blanket on the seat of the chair, which will increase the height for resting the legs. Right elbow pressed on the blanket, right forearm rested, both foot on the seat of the chair, left hand on the waistline, inhale, exhale, rise. Align the hips properly, align the shoulders also properly, look up. As we inhale, abdominal cavity should expand. As we exhale, it should contract. Good breathing is very essential in all the postures. Feel the length and breadth of the spinal column. Feel all the trunk muscles. Slowly descend. Change side. So as the height increases, for lifting the trunk, you need to exert a greater force. Left forearm rested on the blanket, both foot on the seat of the chair, right hand on the waistline. Inhale, exhale, rise. Chest up. Look up. Do not hold the breath. Watch your posture. Watch the shoulders slowly descend. One more time. Right forearm on the blanket, both the feet on the seat of the chair. Inhale, exhale, rise. Left hand on the waistline. While resting on the seat of the chair, you can rest the legs one on top of the other. Look up. Watch your breathing. Watch the lateral muscles. Now the weight of the hips, weight of the trunk has to be balanced on two supports. Slowly descend. Change side. So you have to hold the body against the gravity. Left forearm on the blanket, feet on the seat of the chair, right hand on waistline. Inhale, exhale, rise. All the lateral muscles of the trunk gear up into action. The shoulders also become active. Slowly descend. And get involved in the posture. It should not become a mechanical action. Sit upright. Now we shall increase the height further. Put the blanket on the top rib of the chair. So in doing the side bridge this way, to lift the trunk, you will have to exert more force. Rest the right elbow. Now both feet on the seat of the chair first. Rise the hips. Then take the top leg up. and then the bottom one, and top leg little forward. Breathe well. Do not allow the hips to get pushed back. Turn the neck, look up. Have complete postural awareness. Take the left hand down, then flex the knees, slowly, gently come down. It's very important to descend safely. Change side. Left forearm on the blanket. Press the right palm on the floor, then keep the palm on the waistline. Rest both legs on the seat of the chair, then rise up. Then take the right leg up and then the left leg. Right leg slightly ahead of the left leg so that you can balance well, and then look up. And with increased height in all this side bridge, the balancing becomes quite important, crucial, and this also enables one to enhance the neuromuscular control. Right hand down, then slowly descend. Sit upright. One more time. Right forearm on the blanket. Keep both the feet on the seat of the chair, left hand on waistline, rise up, then left leg up and then the right leg. Left leg slightly ahead of the right. Turn the neck, look up. Do not hold the breath. Keep the legs straight. Feel the complete trunk musculature, the pelvic girdle and the pectoral girdle, that is the shoulder girdle and the hip girdle. Take the left hand down, slowly come down. Change side. Left forearm on the blanket. Right hand on the waistline. Initially you can keep the right hand down, then rise the right hand. That is also possible. Both legs on the seat of the chair, inhale, exhale, rise, then right leg up, then the left leg up. Top leg slightly ahead. Chest up. Look up. Ensure that you don't destabilize the chair. That is very important. Right hand down, then slowly come down. So initially it is a good idea to use one of the sticky mats on which the chair is also rested, so that the chair, you can prevent it from sliding away. Sit upright in the cross-legged posture, chest and navel up. Inhale, exhale, turn to your right side. Left hand on the right knee, right hand fingertips on the floor. Turn. A gentle twist would help your back muscles to greatly relax. That is the reason why these postures are added. Slowly come up, chain, inhale, exhale, turn. Breathe properly, consciously. Have complete postural awareness. Slowly come up. Clasp the fingers, inhale, exhale, rise, both arms up. Because in all these postures that we are doing, the shoulders, the scapulae, they are also greatly involved. So stretch both arms. Tighten the muscles of the upper arm, forearm. So this stretch gives a good relief for the shoulder complex. Chest up. Open the face of the palm up. Slowly flex the arms and relax. One more time, inhale, exhale, stretch both arms, open the face of the palm, arms up and slightly back so that you get a good stretch for the armpit, for both the arms. Do not hold the breath. Slowly flex the elbows, relax both the arms. Put the blanket on the lower rib of the chair. Now we should do one more interesting movement where we start from the side bridge and transition to the downward facing bridge. Right forearm on the blanket, rest both the legs on the lower rib, left hand on the waistline, inhale, exhale, rise, top leg forward, and left leg little forward of the right leg. As you exhale, contract the abdominal muscles. Then keep the left hand at the back, then slowly turn the trunk, face downward, come to the downward facing bridge. Watch that movement. You have to control the movement. Now again, turn back to the sideward bridge. Slowly come down. Chain. Press the left forearm on the blanket. Both feet on the lower rib of the chair, right hand on the waistline. Inhale, exhale, rise the hips. Right leg ahead of the left leg. Take the right hand at the back. Stabilize, balance. As you exhale, contract the abdominal muscles and turn downward. But be stable. Watch your upper arm. Watch your shoulders. Watch your back. Then slowly come back to the side. Watch your breathing. Then slowly descend. Sit upright. Sit in the cross-legged posture. One more time, press the right forearm on the blanket, both feet on the lower rib of the chair. Inhale, exhale, rise. Take your left hand to the back. Inhale, exhale, turn downward. So from side to the downward, as you turn, you should control the movement. You should stabilize. Now again, come back to the sideward bridge. Watch the position of the legs. Top leg slightly ahead of the bottom leg, so that you can turn easily. Slowly come down. Left side. Keep the left forearm on the blanket, right hand on the waistline, both feet on the lower rib of the chair. Inhale, exhale, rise. Chest and navel up. Take the right hand at the back. Inhale, exhale, turn to the downward bridge. This calls for a greater degree of neuromuscular control. Again, turn back to the sideward bridge. As we exhale, contract the abdominal muscles and be aware of the posture and the breathing. Slowly descend. Sit upright. Keep the blanket on the seat of the chair. We are now going to increase the height for resting the legs. And when you increase the height, watch the change in the force on your upper extremities. Inhale, exhale, turn. A gentle twist. Turn to your right side. Breathe well. This kind of a twist relieves the back and also the upper arms and the shoulder complex. Slowly come up, chain. Left hand on right knee, right hand on left knee. Left hand fingertips on the floor and turn. Slowly come up. Right forearm on the blanket, left hand on the waistline. Take the legs one after the other onto the seat of the chair. Rise the hips up. Take the left hand at the back. Both legs straight. Now slowly, gently turn downward. Note the change in positioning the foot and try to keep both the hips even. Again, turn back to the sideward bridge. And as the height increases, the degree of control needed also increase. Slowly descend. Change side. Press the left forearm on the blanket, right hand on the waistline. Take the legs one after the other onto the seat of the chair. Raise the hips, legs straight. Take the right hand at the back. Be stable on your left elbow and shoulder. Inhale, exhale. Slowly turn downward. Keep the legs straight. As you exhale, contract the abdominal muscles. Then slowly turn to the sideward posture. Slowly descend. One more time. Press the right forearm on the blanket, left hand on the waistline. Take the legs one after the other onto the seat of the chair. Inhale, exhale. Rise the hips. When you rise, try to align the trunk, hip and the legs properly. Take the left hand at the back. Slowly turn to the downward bridge. It should be a very controlled, slow movement without jerk. And align the trunk and hips properly. Then slowly turn back to the sideward bridge. Slowly come down. All these bridge poses, these movements help the complete back muscles to gain better stability and strength. Press the left forearm on the blanket, right hand on the waistline. Take the legs one on top of the other. Place them on the seat of the chair. Rise the hips. Take the right hand at the back. As you exhale, gently turn downward. Keep both legs straight. Feel the posture. Get connected with your breath. Slowly come back to the sideward bridge. Slowly descend. Sit upright. We now put the blanket to the top rib of the chair. That is, the height is further increased. Before we move on, sit upright. Inhale, exhale, turn. Left hand on right knee, right hand fingertips on the floor. Turn. Chest and navel up. A gentle twist helps the scapular complex, the thoracic region, also the lower back. Breathe well. Slowly come up and chain. Right hand on left knee, left hand fingertips on the floor. Inhale, exhale, turn. Watch your breathing. Slowly come up You have to adjust the distance between the blanket and the chair properly. Rest your right forearm on the blanket, left hand on the waistline. Take both legs onto the seat of the chair, raise the hips up, then move the legs one after the other onto the top rib of the chair. Top leg, little ahead of the bottom one. Left hand at the back, inhale, exhale, gently, slowly turn downward. Feel the movement. It should be a controlled movement. Then slowly turn back to the sideward bridge. As you do this, do not lose the height of the hips. Hold them firm. Then slowly descend. From a height, especially when you are coming down, it's important that you do not crash land. Chain. Also ensure that the chair does not skid or slide. So it's good to use a mat. Chain. Left forearm on the blanket, right hand and waistline, both foot on the seat of the chair. Rise. Then take the right leg up, then the left leg. Right leg slightly ahead of the left leg, slightly crossed so that you can balance well. Take the right hand at the back. Inhale, exhale, slowly turn downward. Watch your breathing. Then slowly come back to the sideward bridge. Take your right hand down, then bring both legs gently downwards. Sit upright. Put both the blankets one on top of the other. Sit upright in swastikasana. So all these postures help to improve the trunk muscles. They also give you better neuromuscular control, and they go a long way in protecting the lower back, upper back, as well as the shoulder complex. Sit upright. In this the shoulder complex, especially the deltoid muscles, also would come under a lot of stress. So here is a simple stretch. Stretch your right hand, then from left hand pull it closer to the chest. Keep the right hand straight and pull the right hand closer to the chest from the left hand. Release the right hand, chain. Left hand straight, from right hand pull the left hand closer to the chest. There is one simple stretch to take out some strain from the upper arms. Slowly relax. Sit upright. Sit upright. Eyes gently closed. Relax your tongue, nose, throat and the jaws. Have complete musculoskeletal awareness. Chest and navel up. Relax the shoulders. Have complete postural awareness. Watch the feet, ankles, lower legs, knees, thighs, the hips. pelvic cavity, abdominal cavity, chest cavity, the shoulder complex, upper arms, elbows, forearms, wrists, palms, fingers, fingertips. Again there is forearms, elbows, upper arms, shoulder complex, throat and the neck, facial muscles and organs, complete skull cavity. Pay attention to your breathing. Just watch the incoming air and outgoing air. Do not try to control the breath, but just watch the breath. Feel the natural flow of the breath. How it enters in through the nostrils, which nostril is dominant. Just pay close attention to the incoming air and outgoing air. Mind is fond of past. Mind is fond of past and future. Try to be in the present. Now we are going to do the following. You are going to count from 100 to 1 in the descending order. Mentally, without using the lips or the tongue. You have to mentally start from 100, then give a gap of about 4 to 5 seconds, then 99, then again 4 to 5 seconds gap, then 98, so on and so forth till 1. You can start now. You have started counting from 100 to 1 in the descending order. Don't be in a hurry. There should be 4 to 5 seconds gap between each count. Mind is very turbulent in nature. Lot of thoughts come. They rise, stay for a while, and they fall, and something else rises. But do not allow that to happen. Focus on your counting. For that you have to be present. You must come out of that compulsive thinking pattern of the mind. This is a simple technique. To come out of that compulsive thinking mode of the mind. Be aware. Develop that sharp awareness where you are feeling the posture, you are feeling the breath, you are also counting. Your focus should be on the numbers that you are counting in the descending order. Just pay attention. It is possible that the mind skips, shifts to a variety of thoughts, but refocus. It needs practice. This is a simple technique which also helps to assess the status of our mind. The more and more your mind can come to the present, the clarity of counting increases. You are counting the numbers in the descending order. Be aware, be watchful. You are also witnessing your posture, witnessing your breathing. You have to turn your attention completely inward. The mind is an instrument, antahkarana. It should not be allowed to go on its own. That is when it gets into that compulsive mode of constant thinking, shuttling from past to future, future to past, totally missing the present. This is a simple technique of meditation to train the mind to come out of this habitual pattern and to get focused. Even if you miss some counts, don't get discouraged. keep moving. Do not fight with the mind. You must just try to come to the present. Hopefully by now you have counted. You can assess the state of your mind. Was the mind got struck deeply in one thought, not able to move out of it, or the mind was settling sometimes in the present, then lost somewhere, or the mind could be in a highly dormant state, leading to drowsiness, feeling sleepy, or it could be greatly focused so that your counting was with clarity and precision. This also needs practice. So it's good to do this at least for about 5 minutes every day, so that you will learn to break the pattern of habitual and compulsive thinking in the mind. That is a big step in the path of meditation. Namaste.